Neurologist explains, if your nails look like this after 60, your body can be hiding 4 diseases. Take a moment to truly observe your fingernails right now. Engage in a simple yet profoundly insightful exercise. Firmly press down on one of your fingernails for approximately 2 seconds, then release. Pay close attention to the almost immediate return of the natural pinkish hue to the nail bed. This seemingly trivial action is, in fact, a fundamental technique employed by cardiologists to rapidly assess an individual's circulatory health within mere seconds, requiring no specialized equipment whatsoever. What this straightforward test, along with 3 other distinct and visually discernible nail signs, can unveil is a critical piece of information that, regrettably, the vast majority of adults over the age of 60 are never informed about. Your nails possess an extraordinary ability to silently chronicle the daily activities and overall well-being of your heart and blood vessels. The profound challenge, however, lies in the fact that virtually no one is educated on how to interpret these vital, subtle indicators. This lack of awareness becomes particularly concerning after the age of 60, a period when cardiovascular issues frequently begin to develop insidiously, often without presenting any dramatic or overt symptoms until a serious, life-altering event suddenly occurs. In this crucial stage of life, the signs that manifest on your nails evolve into one of the most accessible and non-invasive early warning systems available, entirely obviating the need for a hospital visit or a doctor's appointment just to glean these preliminary insights. I am Dr. Ben Walker, and over the course of more than 2 decades, my professional focus has been exclusively dedicated to preventative health strategies for adults navigating the complexities of life beyond 60. My mission is to meticulously guide you through 4 specific nail signs that have been rigorously substantiated in extensive medical research, directly correlating with an elevated risk of heart attack, stroke, and other severe circulation problems. Among these, the 4th sign holds particular significance, and it is the one I am most eager for you to scrutinize before this detailed exposition concludes. It is a sign that can be effortlessly checked in approximately 3 seconds, and the sheer simplicity, combined with its potential revelations, often genuinely astounds most people. Before we delve deeper into these crucial indicators, I invite you to share your current age in the comments section below and indicate whether anyone in your immediate or extended family has ever experienced a heart attack or a stroke. Your response to this query is inherently relevant to the degree of seriousness with which you should internalize the information we are about to explore. Furthermore, if you find this type of content genuinely valuable and impactful for your personal health journey, a quick like on this video truly assists me in continuing to produce and disseminate such vital information. To fully grasp the profound importance of these 4 particular signs, especially as one progresses beyond the age of 60, it is imperative to cultivate a foundational understanding of the biological mechanisms underpinning your nails' growth and composition. Your nails originate and grow from a specialized structure known as the nail matrix. This matrix is a dynamic layer of living cells meticulously situated just beneath the base of each nail, and these cells are in perpetual, intimate contact with your bloodstream. Consequently, they are exquisitely sensitive and responsive to even subtle fluctuations in oxygen levels, the overall quality and efficiency of your circulation, and the delicate health of the smallest blood vessels permeating your body. The intricate network of capillaries nestled beneath your nail bed represents some of the most minuscule and delicate blood vessels within your entire physiological system. Precisely because of their diminutive size and delicate nature, these capillaries are often the very first components of your cardiovascular system to exhibit discernible signs of distress when your heart and blood vessels begin to falter or struggle. For an individual in their 30s, the heart and blood vessels typically possess an enormous reservoir of functional capacity, enabling the body to effectively mask early-stage dysfunction for an extended period, often without any overt symptoms or visible changes manifesting on the nails. However, after the age of 60, these physiological reserves significantly diminish. This reduction is not indicative of a broken body, but rather a testament to 6 decades of diligent and efficient operation, meaning the margin for silent, uncompensated dysfunction becomes considerably thinner. Therefore, envision your nail bed not merely as an aesthetic feature, but as a direct, transparent window into the intricate state of the smallest blood vessels within your body. When these minute vessels begin to encounter difficulties, the nails frequently serve as the initial site where this internal struggle becomes outwardly visible. It is also worth noting that during a typical 15-minute doctor's appointment, your physician is not necessarily meticulously examining your nails. The limited time frame of such consultations means there is only a finite amount of ground a doctor can realistically cover. And unless something is visually overtly alarming, a detailed nail examination rarely ascends to the top of the priority list. Thus, while this critical information is well documented within specialized medical literature, it does not always seamlessly transition from the clinical research setting to the individual who most urgently requires it. Allow me to guide you meticulously through each of these 4 signs one by one. I urge you to pay particular attention to number 4, as it is the sign that almost no one has ever been explicitly instructed to look for. The first significant indicator is a distinct color change known as cyanosis. Here, an essential distinction exists that most people have never been educated about, and understanding it profoundly alters how urgently you should respond to what you observe. Broadly, cyanosis refers to a discernible bluish or purplish tint visible through the nail bed, particularly noticeable near the base of the nail. However, there are in fact 2 fundamentally different categories of cyanosis, and each carries very distinct implications for your health. The first type is termed peripheral cyanosis. This condition manifests when the bluish discoloration appears exclusively on your fingernails and potentially your toenails. Crucially, in cases of peripheral cyanosis, your lips, your tongue, and the delicate mucous membranes inside your mouth all maintain their normal, healthy pink coloration. Peripheral cyanosis typically develops gradually over a period of weeks or even months. It functions as your body's subtle yet persistent communication that the circulation to your extremities is not performing with the efficiency it once did. It is a clear warning sign signaling underlying issues, but it is generally not an immediate medical emergency requiring urgent intervention. In stark contrast, the second type is central cyanosis. This more severe manifestation occurs when the bluish discoloration is evident not only on your nails, but also distinctly present on your lips, your tongue, and the interior lining of your mouth. The appearance of central cyanosis is unequivocally a medical emergency. Its presence signifies that the blood being pumped out from your heart is dangerously deficient in oxygen, a situation that necessitates immediate medical attention and intervention. Biologically, in both forms of cyanosis, the underlying issue is that the blood reaching the affected tissues is not adequately oxygenated. In the context of peripheral cyanosis, the primary problem usually resides within the circulatory system itself, indicating localized issues with blood flow. Conversely, in central cyanosis, the root cause is typically a more systemic problem affecting the heart or the lungs directly, compromising the body's overall ability to oxygenate blood. Extensive research firmly establishes strong associations between persistent peripheral nail bed cyanosis and a spectrum of serious medical conditions, including early-stage heart failure, certain types of heart valve problems that regrettably often remain unrecognized for decades, and chronic lung diseases that over time place significant and increasing strain on the heart. The profound relevance of this information for individuals over 60 stems from the fact that the prevalence of heart failure dramatically rises with advancing age, making it one of the most frequently underdiagnosed conditions within the older adult population. Early-stage heart failure frequently does not present with dramatic or alarming symptoms. There is typically no acute chest pain, no sudden collapse. Rather, there is a slow, quiet, almost imperceptible decline in the heart's pumping efficiency, which the body compensates for until its compensatory mechanisms are finally exhausted. To illustrate this, I want to share a composite patient story, representative of numerous similar presentations I have encountered. This involves a retired postal worker named Frank, residing in Sarasota, Florida. For nearly a year, Frank had intermittently observed that his nails appeared to have a faint purplish tint at their base, particularly noticeable in the mornings or after prolonged periods of sitting still. He initially dismissed these observations, attributing them to the cooler weather, to a generalized poor circulation he assumed was merely an inevitable part of aging, and to his lifelong tendency to run cold. It was only during a visit from his daughter, who, upon noticing the unusual color of his nails, voiced her concern, that Frank finally decided to mention it during his subsequent routine checkup. His doctor, taking the observation seriously, conducted a thorough examination and promptly ordered an echocardiogram. The results revealed early-stage heart failure, a condition that, importantly, was still highly manageable through the appropriate combination of medication and targeted lifestyle adjustments. Frank's early diagnosis allowed him to avert a critical hospitalization that almost certainly would have occurred within the following year, drastically improving his prognosis and quality of life. The practical, actionable takeaway here is straightforward and vitally important. Examine your nails meticulously under excellent natural daylight, ideally positioned near a window. If the color near the base of your nail bed appears persistently bluish or purplish, and this coloration does not dissipate or change even after your hands have thoroughly warmed up, this is a significant finding genuinely worthy of bringing to your doctor's immediate attention. Specifically, inquire whether an echocardiogram might be a suitable diagnostic step, considering your age and any other existing risk factors. And unequivocally, if you ever observe a bluish discoloration on your lips or tongue in conjunction with changes in your nails, do not hesitate or wait for a scheduled appointment. This constitutes a genuine medical emergency, demanding immediate professional evaluation. Have you ever personally noticed any color change in your own nails? If you are interested in a comprehensive, deep dive video specifically on heart failure warning signs you can identify at home, please type the word heart in the comment section right now. I meticulously read every comment, and the topics that generate the most engagement are precisely the ones I prioritize for future content creation. The second crucial sign is brittle, slow-growing nails. This is an indicator that almost everyone over the age of 60 regrettably dismisses as merely another inevitable aspect of the aging process, overlooking its deeper implications. What I'm describing encompasses nails that break with unusual ease, that peel in distinct layers, that split vertically along their length, or that simply appear to grow at a significantly reduced rate compared to their past trajectory. You might recall a time when you needed to trim your nails every 2 weeks. Now, it seems as though they barely exhibit any noticeable change from 1 month to the next. The underlying biological mechanism at play here is that the nail matrix is not consistently receiving the steady, vital supply of nutrients and oxygen-rich blood it requires to efficiently produce healthy, robust, new nail tissue. One of the most prevalent reasons for this specific manifestation in older adults is a condition known as peripheral artery disease, frequently abbreviated as PAD. Peripheral artery disease develops when the arteries responsible for transporting blood to your extremities, your arms, your legs, and your hands, become progressively narrowed due to the insidious buildup of plaque within their walls. Here's the critical piece of information that most people are never explicitly told. The identical type of plaque that precipitates heart attacks when it accumulates in the coronary arteries supplying the heart, and the same kind of plaque that triggers strokes when it forms in the arteries leading to the brain, is precisely the same form of plaque that builds up in the arteries extending all the way to your fingertips. Consequently, the presence of plaque in one artery serves as a powerful indicator that plaque is highly likely forming in other arterial locations throughout your body. This is why peripheral artery disease is universally recognized by medical professionals as one of the strongest and most reliable predictors of future heart attack and future stroke risk. Individuals who receive a diagnosis of PAD face a significantly elevated risk of experiencing major cardiovascular events when compared to their counterparts without the condition. And here is what frequently surprises most people. PAD often remains entirely silent for many years before any dramatic or debilitating symptom finally surfaces. However, there is a distinct and recognizable pattern of warning signs that tend to appear concurrently. And the ability to recognize this specific combination is far more significant than recognizing any single symptom in isolation. This critical pattern consists of brittle, slow-growing nails, consistently cold hands and feet that take an unusually long time to warm up, and a sensation of cramping, heaviness, or fatigue in the legs when walking, particularly when ascending hills or climbing stairs, which reliably dissipates and resolves with rest. This latter symptom possesses a specific clinical designation. It is called claudication, and it is considered one of the most reliable and telling signs of significant arterial narrowing. If you consistently experience all three of these indicators in combination, brittle nails, cold extremities, and leg cramping that arises with walking distances and resolves with rest, that specific constellation of symptoms genuinely warrants an immediate and detailed conversation with your doctor. A composite patient story that powerfully illustrates this scenario involves a woman named Eleanor from Burlington, Vermont. Eleanor had cultivated a lifelong passion for gardening, dedicating her entire adult life to it. When her nails began to exhibit increased brittleness and started splitting with ease in her late 60s, she initially attributed these changes to years of working her hands extensively in the soil and to the harsh, dry Vermont winters. She diligently tried various dietary supplements and a myriad of nail-strengthening treatments purchased from drugstores, yet nothing seemed to offer any genuine improvement. The pivotal change that prompted her doctor to investigate more thoroughly was something she mentioned almost as an afterthought during a routine visit. She casually remarked that her legs felt unusually heavy when she walked uphill, a sensation that had been slowly and progressively worsening over a period of approximately 18 months. Her astute doctor, recognizing the significance of this observation, performed a simple, non-invasive test known as an ankle brachial index, or ABI. This test precisely compares the blood pressure measured at the ankle to the blood pressure measured at the arm. The results conclusively confirmed a diagnosis of moderate peripheral artery disease. With the implementation of aggressive lifestyle modifications, adherence to a structured walking program, and the commencement of the appropriate medications, Eleanor dramatically reduced her overall cardiovascular risk. Her brittle nails, which had been quietly telling a story of underlying arterial issues for nearly 2 years before being acknowledged, ultimately served as the earliest discernible warning sign. The practical takeaway here is undeniably important. If your nails have become noticeably more brittle or started splitting with greater frequency over the last 1 to 2 years, and you simultaneously experience any sensation of heaviness, cramping, or fatigue in your legs, specifically when you walk, particularly when navigating uphill terrain or climbing stairs, you should proactively ask your doctor about the suitability of an ABI test. It is a simple, non-invasive procedure, and it possesses the profound capability to detect peripheral artery disease at a stage where timely intervention can make an enormous, life-altering difference. Now we arrive at the third indicator, the one I specifically mentioned at the outset of this video, and it is the test I strongly encourage you to perform alongside me right now. This third sign is referred to as the capillary refill test, and you can effortlessly conduct it on yourself in less than 5 seconds. Here's a detailed guide on how to perform it correctly. Position your hand at the level of your heart. Select any fingernail. The index finger typically works well for this purpose. Using the thumb of your other hand, press down firmly and steadily on the chosen nail for approximately 2 seconds. As you apply pressure, you will observe the nail bed momentarily turning white, a visual confirmation that the blood has been gently pushed out of the tiny capillaries located directly underneath. Now, release the pressure and immediately begin counting, using the 1001, 1002 method to accurately gauge the passage of time. Observe with careful attention how quickly the normal, healthy pink color returns to the nail bed. In a healthy adult with robust circulation, that natural pink coloration should return in under 2 seconds. If, however, it consistently takes 3 seconds or longer for the color to return, especially if this delayed refill is observed repeatedly across multiple fingers, this constitutes a significant sign that the smallest blood vessels within your body are not refilling with blood at a normal, efficient rate. Additionally, there's a complementary second test you can perform alongside the capillary refill test, which medical professionals often find highly informative. Gently press the back of your hand against your forehead or your cheek. Your hand should feel relatively close to the same temperature as your face. If your hands consistently feel noticeably cooler than the rest of your body, even when you are in a comfortably warm room, this serves as another important marker indicating reduced peripheral circulation. Performing both tests in conjunction provides a much more comprehensive and nuanced picture of your circulatory health than either test performed in isolation. Biologically, what the capillary refill test precisely measures is the speed at which your microvascular system, the intricate network of the tiniest blood vessels throughout your body, recovers from momentary pressure. A slow capillary refill time indicates that the circulation within these small, delicate vessels is sluggish and inefficient. Extensive research has consistently linked persistently slow capillary refill times in adults over the age of 60 to a spectrum of concerning cardiovascular issues, including reduced cardiac output, meaning the heart is not pumping blood as effectively as it should, undiagnosed atrial fibrillation, an irregular heart rhythm that carries significant risks, and an elevated risk of stroke. The microvascular system is frequently where cardiovascular problems first manifest, because these small vessels possess significantly less reserve capacity compared to the larger, more robust arteries. One critically important note before you become overly alarmed: if your capillary refill time is borderline, hovering around 2 to 3 seconds, this alone is typically not an immediate cause for panic, especially if your hands are cold or if you are currently taking certain types of medication. Some blood pressure medications and beta blockers, for instance, can slightly slow capillary refill without necessarily indicating any underlying health problem. Therefore, it is strongly recommended to repeat the test in a warm room, ensuring your hands are comfortably warm to obtain the most accurate reading. If, even under these optimal conditions, the refill consistently takes 3 seconds or longer across multiple fingers, that is when the observation becomes genuinely meaningful and warrants further attention. The profound significance of this test lies in its ability to provide you with immediate, actionable information, using nothing more than your own hands. You do not require a doctor's visit, no specialized equipment is needed, and no appointment is necessary. All you need is about 5 seconds of your time and adequate lighting. A composite scenario that powerfully demonstrates the value of this test involves a retired postal worker named Walter from Topeka, Kansas. Walter had happened to watch a similar health tip on a daytime health program and, intrigued, decided to try the capillary refill test on himself one evening. To his surprise, he counted nearly 5 seconds before the normal pink color returned to his index finger. He repeated the test on his thumb, then his middle finger, and subsequently on fingers of his other hand, and the result was consistently the same: a noticeably delayed refill. The very next morning, he promptly contacted his doctor's office and meticulously described what he had observed. His doctor, recognizing the potential significance, asked him to come in for an appointment, performed a comprehensive cardiovascular workup, and subsequently discovered that Walter had undiagnosed atrial fibrillation, a prevalent heart rhythm problem that is one of the leading causes of stroke in older adults. Walter was immediately started on appropriate anticoagulation therapy, which, according to current cardiology literature, highly likely prevented a major stroke within the following 12 months. The practical takeaway here is to actually perform the test. Right now, before you continue with this video, execute the capillary refill test on at least 3 different fingers. Ensure you do it in a warm room with warm hands, thereby eliminating the possibility that a cold temperature might artificially skew the result. If your capillary refill consistently takes 3 seconds or longer across multiple fingers, make a note of this observation and bring it up during your next medical appointment. Specifically, inquire whether a comprehensive cardiovascular evaluation, potentially including an EKG, electrocardiogram, and an echocardiogram, would be an appropriate diagnostic step for you. Please share in the comments section right now how many seconds your refill took. I diligently read every single reply. And before I delve into number 4, the sign I promised almost nobody knows about, if this video has proven helpful to you thus far, a quick thumbs up genuinely makes a substantial difference in whether this channel's vital information reaches more people who genuinely need it. Number 4 is the one I have deliberately saved for last, and there is a compelling reason why this particular sign earns its final and prominent position. Number 4 pertains to changes in the lunula, and I can confidently state that most individuals listening right now have never even encountered the word lunula in their entire lives. Take a moment to examine the base of your nail, precisely at the very bottom, situated just above your cuticle. Do you perceive a small, distinct, whitish crescent shape, almost resembling a miniature half moon at the base of the nail? That distinctive formation is precisely the lunula. It represents the visible portion of your nail matrix, the very part where new nail tissue is actively being formed in real time. And remarkably, lunula stands as one of the most profoundly overlooked yet highly accessible diagnostic signals in the entire human body. Here is something of immense importance that most people are never informed about regarding the lunula. The specific pattern of which fingers possess visible lunulas holds as much diagnostic significance as the mere presence or absence of a lunula itself. In a healthy adult, the thumb and the index finger almost invariably display a clearly visible lunula. The middle finger typically also exhibits one. The ring finger sometimes does, but not always, and the pinky finger often does not, and this alone is considered completely normal and non-concerning. Therefore, if your pinky finger lacks a visible lunula, but your other fingers clearly display them, this observation is not medically worrying. What is concerning, however, is when this established pattern undergoes a noticeable change. This includes scenarios where lunulas you previously could clearly see on your thumb and index finger have mysteriously disappeared. When lunulas across all your fingers have become noticeably faded or barely visible, or, critically, when the color of your lunula has shifted to anything other than its normal, characteristic pale white hue. These color shifts, in particular, are exceptionally telling, and each distinct alteration often points toward a different underlying health condition. A reddish lunula, for instance, has been consistently associated in clinical research with conditions such as congestive heart failure and with various rheumatic conditions that can directly affect the heart. A bluish lunula can strongly suggest the same underlying oxygenation and circulation problems we discussed earlier in the context of cyanosis, indicating a systemic issue with blood oxygen levels or flow. A very pale lunula that is almost faded into the rest of the nail can be suggestive of anemia, a condition that carries its own significant and direct connection to increased cardiovascular strain and workload on the heart. The reason why this specific sign deserves the final position in today's comprehensive video is that the lunula is something almost no one is ever explicitly taught to examine, and yet it represents one of the most accessible and visible physiological signals your body has to offer. The vast majority of people have never been instructed to carefully inspect the base of their nails for anything other than obvious signs of infection. Consequently, a vital sign that could potentially prompt a crucial conversation with their doctor often goes entirely unnoticed and unaddressed for years, allowing underlying conditions to progress. A composite case that I find particularly instructive in highlighting this point involves a grandmother named Dorothy residing in Asheville, North Carolina. Dorothy was 72 years old and had generally enjoyed robust health throughout her entire life. During a casual phone conversation with her daughter, who happened to be a registered nurse, Dorothy mentioned, almost as a joke, that the little white half moons on her fingernails seemed to have completely disappeared. She couldn't even recall precisely when she had last seen them. Her perceptive daughter gently but firmly encouraged her to bring this observation to the attention of her doctor during her next physical examination, which Dorothy reluctantly did, feeling somewhat silly about mentioning something as seemingly trivial as her nails. Her doctor, however, took the observation very seriously, immediately ordering a complete blood count and a comprehensive cardiovascular risk assessment. The blood work revealed significant anemia that had been developing slowly and insidiously over time. Simultaneously, the cardiovascular workup unveiled early signs of strain on her heart. Both conditions were promptly addressed and managed before they had the opportunity to progress to anything that would have undoubtedly caused a major life-threatening event. The change in Dorothy's lunula was the very first observable sign, and it could have very easily been missed for another 2 or 3 years if her daughter had not encouraged her to mention it, potentially leading to far more serious health complications. The practical takeaway here is profoundly simple. Examine your thumbs and your index fingers right now under excellent natural light. If your lunulas are entirely missing across most of your fingers, if they have noticeably shrunk in recent years, or if they have unequivocally changed color, that is a significant observation that you must bring up at your very next medical appointment. Specifically, request a complete blood count and a thorough cardiovascular risk assessment from your physician. Now that we have thoroughly covered all 4 of these vital signs, allow me to provide you with a comprehensive, practical framework for effectively utilizing this critical information. Because knowing something and actively acting upon that knowledge are 2 distinctly different things, and my aim is to help you bridge that gap effectively. Begin today by undertaking a very simple yet highly informative exercise. Take both of your hands to a window where there is abundant natural daylight. Meticulously examine each nail on both hands. Carefully note the overall color of each nail bed. Observe whether you detect any persistent bluish or purplish tint. Pay attention to whether your nails feel unusually brittle or if they appear to have been growing at a noticeably slower rate. Perform the capillary refill test on at least 3 different fingers, precisely timing the return of color. Scrutinize the base of each nail for the presence of the lunula, noting which fingers display visible ones and which do not. To create a baseline for future comparison, take a clear photograph of both of your hands. Having a consistent visual record over time is genuinely invaluable because gradual changes, by their very nature, can be remarkably difficult to remember accurately over extended periods. This week, if any of the signs we have discussed today match what you have observed on your own hands, diligently write it down. Make a specific note of the particular sign, which finger or fingers exhibited it, and roughly how long you have noticed this change. Bring this written note with you to your very next doctor's appointment. Critically, within the next 30 days, if you observe 2 or more of these signs concurrently, do not wait for your annual physical examination. Immediately call your doctor's office, Clearly describe what you have seen and specifically inquire whether a nurse can conduct a quick phone triage to help you determine if you need to be seen sooner than your scheduled appointment. And, perhaps most importantly, please refrain from attempting to diagnose yourself based on any single sign in isolation. What truly matters is the comprehensive clinical picture, which encompasses your complete medical history, your current medications, any other symptoms you might be experiencing, and, crucially, what your doctor discovers during a thorough physical examination. The overarching purpose of today's detailed video is to empower you to become a more informed, proactive, and engaged participant in that essential conversation with your healthcare provider, not to replace it. Here is the final enduring message I want to impart upon you. Your body has been communicating with you, sending you signals, some loud, some quiet, some subtle, every single day throughout your entire life. And the truly remarkable aspect of progressing beyond the age of 60 is that you possess more context, a wealth of lived experience, and greater access to sophisticated medical support and resources than at any other point in your life. The 60s, the 70s, and the decades that follow are not a time when meaningful and impactful health changes become impossible or unattainable. On the contrary, extensive medical research consistently demonstrates that early detection and informed, diligent attention to these kinds of subtle bodily signals can dramatically alter health outcomes, even in the later decades of life, significantly improving longevity and quality of life. The nails you glanced at this morning and perhaps initially dismissed as uninteresting or insignificant may in fact represent the most accessible and telling diagnostic window your body has gifted you. You simply needed to know how to interpret and read them, and now you do. If you found this comprehensive video helpful and informative, please consider subscribing to the channel. It genuinely is the most effective way to ensure you do not miss what critical health information is coming next. And if someone you deeply care about, a spouse, a sibling, a cherished friend, could significantly benefit from understanding these 4 crucial signs, please share this video with them. The next person you forward this to may very well be the one who notices something vitally important on their own hands tonight, potentially changing the trajectory of their health for the better. I will see you in the next video.